Hey guys, another palate expansion case I wanted to go over real quick. This is a patient that started with the palate expander right around the same time as the other patient that I showed you last week. Um, we started several cases right around the same time. It seemed like everybody that came in about 9 to 12 months ago had narrow arches, and that just seemed to be around the time I took the course on palate expansion. So, what we did with this patient is upper palate expander as usual, as we looked at last time with the lower Invisalign. On the left, that was her initial. And let's see when that was started. That was approved. So it looks like January. So, that's really good, and maybe 8-9 months for lower Invisalign and then upper expansion. As you'll find, expansion allows teeth that are sitting outside the alveolar crest to be nudged in by the lip. If we recall, tooth position is defined by a balance between tongue pressure and lip pressure. That's pretty much kind of where teeth end up going, unless they end up being erupting in certain spots and then being trapped, like this tooth is here. The point I bring this up is as you expand the arches and you create arch length, you actually start to see the teeth drift in place. It might be a little bit hard to appreciate that here, but I can tell you that I've seen cases where we've done that. If you just simply look at number 7 here, again, there's no Invisalign on the upper. We're just expanding the arch. There's no force being placed on number 7 here. I don't know about you, but that looks a little bit less entangled than that. Same here. So as we start to increase the arch width, we start to get more room for the teeth to come in. How much expansion has she had? So what I do is I turn on the grid. I slide the teeth to line up with one of these square boxes here. These are 10 by 10. So I line the innermost or most medial portion of the first molar, and then I come over here. That's 1, 2, 3. So I know this is 30, and then I count backwards. You can count whatever way you want. But essentially, she's currently at, looks like 27 and a half. If I come over here, this was the beginning, and I count 1, 2, 3, 4, maybe 4.3. She's got about 2 millimeters of arch expansion already. She's admittedly not worn them as much as she should. She's a teacher. She has a hard time wearing them at school. With that said, we have some arch expansion. Her expander isn't fitting too well at this point, so we have the decision: do we make her another palate expander, or do we put her into Invisalign? And that's the decision I have to make right now. I am going to have Chantel call her and see if she's interested in another round of expansion. Technically, we should charge the patients if they're not wearing the expander, and that's why it's not fitting. With that said, I still feel like we're in kind of the learning phase of this particular technique. So anytime that's the case, I always kind of err on the side of giving patients, or not trying to nickel and dime patients. I don't nickel and dime patients unless I had a very thorough conversation with them about the possibility of this happening at the outset. Had I told her, if you don't wear your expander and we don't get as much expansion, we have to order another tray, that'll be on your bill, then I would be okay doing that. I haven't had these experiences yet, so I didn't have that with conversation with the patient, so I'm not going to charge her for this. We always have to be careful about what we give away each day in the dental chair. With that said, good decisions often end up paying for themselves tenfold in the long run. Topic for a thorough discussion at some point in the future, what to give away and what not to give away. Anyways, I thought you guys would find this interesting. I will keep you posted on this case. I actually had another case. Yeah. Let's quickly look at this one. I haven't looked at this one yet. So it's not uncommon that Invisalign will add attachments after the fact. So here we are We started about a year ago. I don't believe, yeah, the patient didn't actually accept until, I feel like she didn't get her trays until much later. Yeah, I'll have to do some research on that. It looks like it was accepted about a year ago. Anterior open bite, obviously posterior teeth not lining up well. This was her initial setup, and you can see they're already starting to line up better. This patient, we did expansion. I can tell that because I don't have any buttons on the upper teeth, just on the lowers. But it looks like, you know, we've lined up the teeth better. She already has a better occlusion. If we look at, let's see, this here. Yeah, I guess it doesn't look as good as I thought here. But she was only touching on the back teeth. This is a gnathologic problem when patients are only biting on their back teeth. Nothing good can come of that. But we're starting to get some contacts in the front. My guess is that one big contact there and this contact here is just getting in the way from her actually getting quite a bit of contacts all the way around. With that said, she doesn't look like she has a whole lot of expansion. Chantel did tell me that she doesn't think she's wearing this at all. So it looks like 10, 20, 30, almost 32, 10, 20, 30. We get 2 millimeters of expansion. Okay. Maybe it's just not as profound as the other patient because the arch is fairly, I don't want to say well developed, but she has good arch form. So my guess is that's why we're seeing, or we're not seeing it as obvious as the previous one. So I will work this case out. I'll most likely go to Invisalign with this one just because Chantel said that this patient wasn't wearing the trays, the expanders. And I feel like we've achieved some arch expansion. And I feel like we can get these aligned pretty well. And her occlusion already looks much better since we've been working on the lowers this entire time. Again, arch expansion only occurs, well, it occurs on the upper. You can do the lower. I don't have any experience with that yet. But you can see we've already started to upright these teeth compared to this. And when you upright teeth, you increase the axial forces down the long axis of the tooth, which is favorable from an occlusal perspective. All right, so that's it for tonight. Thought I'd share. Hope everybody has a good night, and we'll see you all tomorrow at the fun night of phlebotomy with Tiff.